can see, here we are starting with absolute isolation. It should be noted that there is both relative and absolute isolation. In this case, we carry out an absolute one to completely protect the other components of our oral cavity. What we were trying to do was, first of all, to drill the rubber dam with the dam perforator according to the teeth we will need and according to the clamp we will use. After that, we measure the appropriate clamp, which is the one that is going to support the molars and allow everything to stay in place. We placed the appropriate one with the help of the clamp holder. Afterwards, we placed the arch support, which is the young arch, and inserted the dam in each corner, at the same time pulling it so that it stretches completely. Now, we insert the holes already made, including the clamp, in each dental piece we will work on, and then we make sure that they fit perfectly around each tooth, and for this, we can help ourselves with some tweezers or a probe. It can be an exploratory or a periodontal, so that it is possible to cover everything around each tooth. It is time to rinse the areas, and with the help of saliva ejectors, like the green one shown in this video, we try to dry the areas very well and suck up the water. In this case, we also use the dental surgical aspirator, the white one shown, since it is thinner and sucks the cavities easier. We apply Concepsis to disinfect cavities and root canals to reduce the risk of recurring cavities and sensitivity to leave them completely dry. We applied dental liner Theracol, which is placed in a thin layer over exposed dentin within a cavity preparation. Some of its functions are dentinal sealing, pulpal protection, and thermal insulation. With a dental mirror, we can help us see if we did it correctly, so that now we can photocure with the curing light. And we did the same one more time. Liners or cavity liners are coatings that are placed in thin thicknesses no greater than 0.5 millimeters and of fluid consistency. They are represented by calcium hydroxide, glass ionomer, and flowable resins. Then we applied orthophosphoric acid, which demineralizes the surface and opens up the dentinal tubules, improving adhesion. The orthophosphoric acid acts by demineralizing the dental enamel, creating micropores that increase the adhesion surface and therefore a greater adhesion of the restorative materials. The orthophosphoric acid is known as a dentin and enamel etchant acid. And what we are trying to do here is basically trying to make sure to completely cover all the cavities and to fill them in. And here we just make sure we clean up well. The water will make the orthophosphoric acid come off, and the ejector will help suck the waste out of them. And we can also take a closer look to supervise that everything is running good. We need to make sure that the cavities are completely dry in order to continue with the next step. Okay, so now that it seems that our cavities are completely dry, we can continue with our next step. Keeping the cavities dry, we apply All-Bond Universal with a microbrush like the green one we see in this video all over the interior, which is a light curing dental adhesive for dental restorations. As a universal adhesive, it can be used with direct and indirect restorations, and it's formulated to be compatible with light curing, dual, and self-curing materials. All-Bond Universal is a water and ethanol-based dental adhesive that bonds to dentin and enamel, cut and uncut. It can be used with or without a phosphoric acid etcher. We photo cure for a few seconds. And start filling the cavities with Beautiful Flow Plus, which is an injectable hybrid filler composite for the anterior and posterior area with a microbrush like the green one shown in this video. This process is done in parts because everything we photo cured is hardened. Beautiful Flow Plus combines the application properties of a fluid with the stability, durability, and aesthetics of condensable hybrid composites. We fit it with another microbrush and light it again. We were just repeating the same steps and helping ourselves with a dental mirror. Again, with a dental mirror, we observe that it is fitting well and we photocure once again for a few more seconds. We can remove the excess with a dental excavator and continue the steps already mentioned where necessary. Like I said, this process is really repetitive, and we need to be really careful in order to keep going on. We are really close to get to the next step. This process is a little bit long, so just keep watching. In this case, we used paste resin. It was not possible to use fluid resin since the cavities were very deep and the paste resin is harder. So it is the best for cases like this. Tetric and Ceram A2 was the resin we used, and we applied it with a resin spatula, like the black one we can see. A2 refers to the color we use, since there are white and yellowish colored resins, but we try to use the most suitable for natural teeth so that they can look as natural as before. It is a light-curing radiopaque dental restorative composite based on nanohybrid composite technology. Useful for the aesthetic restoration of teeth in the anterior and posterior region. We must accommodate the resin very well and crush it so that it is as good as possible, and obviously we cure it. As I mentioned, it is done in parts to be able to feel everything without ruining it. What we want here is to keep the natural anatomy from our teeth. So we were giving them form so that they were as similar as possible and that their cusps are the same. We move our resin with a new microbrush to improve the filling. And let's not forget the dental mirror again, since it is very useful to be able to see where it is not possible to see from the angle we are at. add more beautiful float plus A2 again. Kept repeating the same steps. There is a lot of importance in doing a correct process. If the dental reconstruction remains high from occlusion, it can inflame the pulp and the periodontal ligament, which results in sensitivity or pain after the dental filling. Another reason why a dental filling hurts is when it is very large and it is close to the nerve. Helped me to record this video so I can see myself in it. So this is why I'm narrating the process. We applied the Ox, a viscous glycerin-based gel that we use to coat light-curing resin materials. It is an oxygen inhibitor that prevents exposure to oxygen and prevents the formation of an oxygen-inhibiting layer on the surface of the resins when they are polymerized. has been a somewhat repetitive process that requires patience and being careful so that everything turns out well. It is an easy aesthetic treatment that can be done in several ways and with different materials, and that also allows us to have the natural anatomy of our teeth. I chose this treatment as many of us required it at some point, and many people have no idea what it is and what it consists of. It was necessary to advise our patients to have proper oral hygiene, to brush his teeth properly, to use dental floss, and to take care of his daily diet. Apply more Deox on the top and photocure for the last time. Then, we'll remove the clamp and the rubber dam. We are about to finish, and it is time to check the occlusion of our patient, which is the contact of the teeth of the upper and the lower jaw. For this, we use the joint paper which leaves a blue stain on the teeth that have excess material. We ask our patient to grind his teeth back and forth as well as from side to side, and we also ask him to make movements with his jaw and to bite as he normally does. Our patient did not show any discomfort or any high points, and that is how we ended up. We scheduled his next appointment, said goodbye to him, and obviously cleaned up the dental unit. Thanks for watching!